Hello again, my friend. I'm Dr. Maya Kapoor, and I'm truly glad you're here with me today. I know this might not be the easiest video to click on, and if you've made it this far, that tells me you care about your health, your body, and maybe even about understanding yourself a little more deeply than the world often gives you credit for. So, thank you for trusting me with your time. Today, we're going to have an honest, respectful conversation about something that many men experience, but few ever talk about out loud: masturbation. Specifically, whether doing it every day affects your prostate health. Is it helpful, harmful, or somewhere in between? I want to give you answers that are grounded in science, but also in compassion, because this isn't just about anatomy. It's about dignity and connection, and reminding you that your body still matters. Now, I know the very word masturbation can stir up discomfort. Maybe it brings back old messages from childhood or religion. Maybe it's something you've quietly wondered about, but never felt comfortable asking. Or maybe you've just accepted whatever you read online or overheard in the locker room decades ago, that it's bad for you, or that it drains your energy, or that if you keep doing it at your age, something must be wrong. But here's what I want to say clearly, right from the start. You deserve better information, not scare tactics, not shame, just real answers. And that's exactly what I'm here to offer you today. Masturbation is something most men have done, often for decades. But as we get older, our relationship with it can shift. It can become less about curiosity or release and more about comfort, loneliness, or even habit. And over time, as questions around health or performance creep in, it's easy to wonder, am I doing something wrong? Could this be affecting my prostate? Should I be worried? These are not foolish questions. In fact, they're the kind of questions I wish more men would feel safe enough to ask. Because the truth is, your prostate is a small but incredibly important part of your body. It sits just below your bladder and wraps around your urethra. It's about the size of a walnut, but don't let its size fool you. It plays a central role in your sexual health, fertility, and even your overall sense of vitality. And yes, it's also vulnerable. As men age, the prostate becomes more prone to inflammation, enlargement, and in some cases, even cancer. So, asking whether frequent ejaculation from masturbation or partnered sex affects it, that's not only fair, it's wise. So today, we're going to walk through this together. I'll share what science actually says. I'll clear up some common myths, and I'll give you some practical advice you can use to take care of your body, because you deserve to feel informed, empowered, and at ease. And don't worry, I'll keep things respectful and grounded. This won't be crude and it won't be clinical, just real talk from one human being to another. Ready? Let's begin. Understanding the prostate, a small gland with a big role. Let's start with understanding the organ at the center of all this conversation, your prostate. Because in order to talk about how masturbation may or may not affect it, we first need to understand what it actually does and why it matters so much, especially as you get older. The prostate is a small gland, roughly the size of a walnut, tucked just below your bladder and wrapped around the urethra, the tube that carries both urine and semen out of your body. You might never have thought much about it before your 50s or 60s, but the truth is, this little gland is doing big work behind the scenes. Its main job is to produce seminal fluid, the nourishing liquid that carries sperm during ejaculation. That fluid isn't just important for fertility, it's also one of the many ways your body keeps the reproductive system running smoothly. Now, here's where things start to matter even more. As men age, the prostate becomes more vulnerable. It's not your fault. It's not a sign of failure. It's simply part of the aging process. Over time, some men experience an enlargement of the prostate, known as BPH, benign prostatic hyperplasia. Others develop inflammation, known as prostatitis, and for some there's a more serious concern, prostate cancer. These conditions can cause everything from difficulty urinating to discomfort in the pelvic region, and yes, even shifts in sexual function and mood. That's why taking care of your prostate isn't just about avoiding disease, it's about preserving comfort, ease, and a sense of confidence in your body. And here's where ejaculation enters the picture. There's growing evidence that regular ejaculation, whether through sex or masturbation, may actually play a role in keeping the prostate healthy. It's not just about release or pleasure. There's a physiological benefit. Ejaculation helps clear out the ducts of the prostate. It flushes out old seminal fluid, reduces the buildup of inflammatory compounds, and encourages fresh blood flow. Some researchers have even compared it to rinsing the pipes, keeping things moving and reducing the risk of congestion that can lead to long-term inflammation. So when I hear a man in his 60s or 70s say, "Doctor, I still masturbate almost every day. Should I be worried?" My answer, more often than not, is not necessarily. In fact, that might be doing your prostate more good than harm. But don't just take my word for it. We'll get into what the research actually says in the next section. For now, I want you to sit with this truth. Your body, even in older age, is still capable of responding, still capable of feeling, still capable of healing. The prostate doesn't need to be feared or ignored. It needs to be understood. And as we continue, I'll help you do exactly that. What science says, ejaculation and prostate cancer risk. So now that we've laid the groundwork, let's talk about what the research actually says. Because as much as I believe in intuition and lived experience, I also believe in science. And thankfully, in recent years, researchers have begun to take this question seriously. Does frequent ejaculation, like through daily masturbation, affect the prostate in a meaningful way? The answer, according to some compelling studies, appears to be yes, and in a good way. One of the most talked about pieces of research on this subject came out of Harvard University and was published in a respected journal called European Urology. This study followed more than 31,000 men over the course of 18 years. Just pause with me for a moment. Can you imagine the scope of that? 18 years of watching men's health, habits, and outcomes. And here's what they found. The men who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer, about 31% lower, compared to those who ejaculated only 4 to 7 times per month. That's not a small difference. That's a powerful suggestion that our bodies are asking us to stay engaged with them, to keep the system moving. Now, the question becomes, why would something as simple as ejaculation lower the risk of prostate cancer? And here's where it gets fascinating. Scientists believe that regular ejaculation might help flush out potentially harmful substances that can build up in the prostate over time. Things like inflammatory compounds or old cellular debris. Think of it like this. The more often the prostate is emptied, the less chance those irritants have to sit, stew, and cause trouble. It's like clearing out cobwebs before they become something more serious. But that's not all. There's also a hormonal and emotional piece to this puzzle. When you climax, whether through sex or solo touch, your body releases a cascade of hormones like oxytocin and endorphins. These are the very same feel-good chemicals that reduce stress, ease tension, and help balance your mood. And stress, as we now know, can play a significant role in inflammation and disease. So frequent, healthy release might not just be good for your plumbing, it could be quietly supporting your heart, your immune system, even your sleep. Another study, published in the Journal of Sexual Medicine, supported these findings, showing that regular ejaculation, especially in younger decades, may have long-term protective effects later in life. Now, I'm not saying there's a magic number for how often a man should ejaculate. Everyone's body rhythm and needs are different. But what I am saying is that we can finally put to rest the fear that daily masturbation is somehow inherently harmful. In fact, for many men, it may be an essential act of maintenance, one rooted not in guilt, but in self-care. So the next time you feel that familiar urge, I want you to remember, your body is speaking to you, not out of addiction, not out of weakness, but out of wisdom. It remembers what it needs. And honoring that doesn't make you undisciplined. It makes you attentive, respectful, and alive. Busting the myths, what masturbation doesn't do. Let's take a moment to clear the air, because when it comes to masturbation, especially later in life, there's no shortage of myths floating around. Some of them sound old-fashioned, like whispers from another time. Others are dressed up in medical-sounding language, but have no basis in real science. And unfortunately, these myths don't just confuse people, they create shame. They make good men doubt their bodies, their instincts, and their worth. So let's gently shine some light on these old stories and see what's actually true. One of the most persistent myths I hear is this: masturbation causes infertility. Now, I want to say this as clearly as I can, that is simply not true. Your body is continuously producing sperm. That's part of your biology, whether you're 25 or 75. Ejaculation doesn't use up your fertility. It doesn't deplete some limited reserve. Sperm is being made all the time, and when you release it, you're just letting go of what's already there. Infertility, when it happens, is usually the result of underlying medical conditions. Things like hormone imbalances, chronic illness, or long-term medication side effects. Masturbation is not to blame. In fact, keeping the pipes moving, so to speak, can support a healthier reproductive system overall. Another myth I hear often, and this one stings because it's so tied to masculine pride, is the idea that masturbation weakens the body, that it makes you tired, drains your energy, or leaves you feeling less of a man. I understand where that fear comes from. Many of us were raised in cultures where sexuality was something to hide, to suppress. But here's the truth. There is no medical evidence that masturbation weakens your body. On the contrary, the hormonal release that comes with orgasm can help reduce blood pressure, ease muscle tension, and support restful sleep. If anything, a healthy sexual rhythm, solo or with a partner, can revitalize you. It's not about loss, it's about renewal. And then there's the more modern myth I often hear from men who read just enough online to get worried. If I masturbate regularly, I'll never get prostate problems. I wish I could say that were true, but while frequent ejaculation does seem to lower the risk of prostate cancer, it's not a cure-all. It won't prevent conditions like BPH, benign enlargement of the prostate, or prostatitis, which is often caused by infection or chronic inflammation. Those conditions need their own forms of care, like diet, exercise, regular checkups, and sometimes medication. Ejaculation is one piece of the puzzle, but not the whole picture. So if you've been walking around with quiet guilt, wondering if your body's natural urges are somehow betraying you, I want you to let that go. You are not broken. You are not shameful. You are human. And like every human being, you deserve to feel connected to your body, not confused by it, not afraid of it, not punished for simply responding to it. Understanding what masturbation doesn't do is just as important as knowing what it can do. And now that we've cleared the fog a bit, we can move forward towards something even more important, recognizing when this part of your life may be tipping out of balance, when it becomes too much, listening for the signs. By now, you've probably gathered that I'm not here to shame or scold you for touching yourself. Quite the opposite. I want you to feel respected, supported, and informed. But with that said, let's talk honestly about something just as important as the benefits of masturbation, its limits. Because yes, even something natural and healthy can become unhelpful when it starts to throw the rest of your life out of rhythm. And for many men, especially after 60, it's not about how often they masturbate, but why they do it, and how it fits into the rest of their emotional and physical life. Let me start with this. For most men, masturbating daily is perfectly fine. In fact, as we've already discussed, it may have positive effects on prostate health, mood, and even sleep. But when it becomes something you have to do, when it starts to interfere with your relationships, your responsibilities, or your ability to feel present in your own life, that's a different story. I've had many older patients confide in me, often in a quiet, embarrassed voice, that they've begun to feel emotionally disconnected from their partners, that touching themselves has become more of a routine than a release, that the satisfaction feels hollow, and in some cases, they're not sure how to stop. The truth is, this kind of compulsive behavior doesn't start overnight. It can creep in slowly, especially if you're dealing with loneliness, boredom, or emotional stress. Over time, it may become a substitute for intimacy, one that feels safer, less complicated, and more under your control. But eventually, you might notice that something feels off, that the closeness you once craved from a partner no longer stirs you. That fantasy has replaced connection. That release leaves you feeling more tired than fulfilled. There's also the physical side of overdoing it. If you find yourself feeling sore, overly sensitive, or even struggling to stay aroused with a partner after frequent solo sessions, that's your body asking for a little breathing room. The genital area, like any part of the body, can experience fatigue. Sometimes a break, just a day or two, is all it takes to reset your sensitivity and remind yourself of what pleasure really feels like when it's not rushed or routine. And then there's something I see more and more in this digital age: men who rely heavily on pornography. I say this without judgment, but with concern. Porn, when used occasionally and mindfully, isn't necessarily harmful, but when it becomes the only pathway to arousal, it can distort expectations. The brain starts to expect exaggerated, fast-paced imagery in order to feel stimulated, and real-life connection, soft touch, quiet presence, emotional closeness can begin to feel dull in comparison. I've met men who struggle to feel anything at all without it. That's not weakness, it's just the brain adapting to overstimulation, but it can be reversed. It starts with awareness. So how do you know if it's too much? Ask yourself this: is masturbation adding to your well-being, or is it starting to take something away? Does it leave you feeling more grounded and satisfied, or more isolated and depleted? There's no universal number. For one man, daily release is healthy and restorative. For another, once a week is more than enough. It's not about how much, but how it feels. And if you're unsure, if you feel stuck or a little lost, I want you to know it's okay to talk to someone: a doctor, a therapist, even a trusted friend. Asking for help doesn't make you weak. It makes you human. Sometimes just saying the words out loud is enough to lift the weight. Your sexuality is not separate from your health. It's a reflection of your relationship with yourself, your body, your emotions, your boundaries. And as with any relationship, it deserves care, honesty, and kindness. Beyond masturbation, a whole-body approach to prostate health. Now that we've explored the role masturbation can play, both its benefits and its boundaries, let's zoom out for a moment. Because while ejaculation might help support your prostate, it's only one part of a much bigger picture. Your body is like a system of connected rivers: blood flow, hormones, stress, sleep, nutrition. When one stream slows or gets blocked, the whole system feels it. That's why, if you truly want to protect your prostate and preserve your vitality after 60, we need to talk about the whole landscape. Masturbation might clear the path, but it can't carry the weight alone. So let's start with something simple but powerful: your diet. I know that after a certain age, changing eating habits can feel like an uphill climb, but it doesn't have to be drastic to make a difference. The prostate thrives on foods that reduce inflammation and nourish circulation. Think about adding more tomatoes. They're rich in lycopene, a compound that's been linked to lower prostate cancer risk. Add in healthy fats from nuts, seeds, and olive oil. Fatty fish like salmon can help too. Omega-3s reduce inflammation, which is key to protecting the prostate from swelling and irritation. And just as important, reduce processed foods and red meat when you can. You don't need to be perfect. You just need to be intentional. Movement is the next piece. You don't have to run marathons. You don't even need a gym. But regular physical activity, brisk walking, gardening, stretching, helps keep your blood flowing. That blood carries oxygen and nutrients not just to your heart and brain, but also to your pelvic organs. Gentle pelvic floor exercises, often called Kegels, can also support prostate function and help with issues like urinary dribbling or weak flow. These muscles are often forgotten, but they're essential. And they're still trainable, even well into your 70s and 80s. And then there's the quiet force that too often goes ignored: stress. Chronic stress doesn't just weigh on the mind. It wears down the body, weakens the immune system, and disrupts your hormones. When you're under constant pressure, financial, emotional, or even just the low hum of worry, it affects your testosterone levels. It affects your sleep. And yes, it affects your prostate. That's why managing stress isn't a luxury. It's medicine. Whether it's through prayer, meditation, music, walks in nature, or simply carving out 10 minutes of quiet each day, your nervous system needs space to breathe. One of the most overlooked habits that can save lives? Getting your prostate checked. I know it's not anyone's favorite appointment, but early detection changes everything. For most men, I recommend starting annual screenings around age 50. Earlier if you're African American or have a family history of prostate cancer. A PSA blood test and a quick digital rectal exam may not be pleasant, but they're fast, effective tools. And believe me, catching something early can mean the difference between simple treatment and serious illness. And lastly, please don't overlook connection. If you're in a relationship, talk with your partner about what's happening in your body. Share what feels good, what feels off, what feels tender. Intimacy doesn't have to look like it did in your 30s to still be meaningful. And if you're not currently with someone, that doesn't mean you're alone. Connection comes in many forms: friendships, phone calls, even moments of eye contact with someone who sees you. Because at the end of the day, prostate health is not just about one gland. It's about your experience of being alive, present, supported, and cared for. You deserve that in every sense. And the steps you take today, however small, will echo into how you feel tomorrow. If something in today's video spoke to you, even just a little, I'd truly love to hear about it. Leave a comment and share what you're feeling or wondering. I read every word. If you'd like more honest, gentle guidance like this, I invite you to subscribe. And if you know someone who might need a quiet reminder that it's not too late, please pass this along.